Hi, Dr. Pelto here. I get a lot of questions about pain to the front of the foot, and the technical name for forefoot pain is pain to the front of the foot. It can be caused by a lot of things, and I want to go over a few of the most common ones and some of the common treatments for you. First, you have to think of how this impacts your life. You're probably coming to see someone if you have pain, if you have frustrations, or you can't walk for exercise. Specifically, this happens after a lot of people do a lot of walking. At this time, people are doing a lot of hiking, and they're doing walking for exercise, so they start to have this pain to the front of the foot. This can cause weight gain, the fear of surgery, the fear of missing out at work, and not being as active as you'd like. What can cause it? There is just a plethora of things that can cause forefoot pain. I don't want to go too much into detail about all of these, but we'll start with the most common ones. Now, if on the front of your foot, if you have pain and there's a callus there, it's probably that callus that's causing it. If you're doing a lot of walking or activity, very commonly this can cause a stress fracture. And this can be found either with a tuning fork test, which we'll talk about, or some other type of imaging like an x-ray. What's very common and very commonly misunderstood would be bone swelling. I kind of explain bone swelling like kind of like a tea kettle. If you get it really, really hot, eventually it'll kind of burst with the water in there, and it's kind of bone swelling happens, and then it leads to a stress fracture. It can also be caused by a metatarsal length, and I'll show you that in an x-ray with one bone is longer than the other. It can be caused by a plantar plate tear. So I want to share, if you hyperextend some of these joints, or if you have like a toe that goes up like a hammer toe, it can cause an injury to the plantar plate. You could have a long metatarsal, which is a longer bone. You could have a hammer toe. Once again, this curvature of the bone here can cause more pressure. It's called retrograde pressure that can go. You can see this arrow pointing down. You can also have a neuroma, which is a pinched nerve. It could be a bunion. It could be a bone where you lose the blood supply to the bone. That's the technical term for that. You could have just fat pad reduction. When we get older, we lose the fat. So that also could be it as well. And then a tight calf. If you have a really tight calf, that can cause forefoot pain. So let's go into looking a little bit more at this. You have to look at how long you've had it. You know, if it's been less than 3 months, it's a little bit easier to get rid of. If it's been over 3 months, it takes a little bit longer. And then the treatments that you've tried. Typically on an x-ray, I'd like to show people if you have like any changes to the sides of the bones, sometimes that can cause metatarsal pain, or if like the hammer toe goes up like this, that could cause it. There can also be things you can see on an MRI, like a Morton's neuroma or a bursitis or inflammation around there. So there's a lot of other things that can be done. And also you want to look at if one of the bones is longer. You see how this red circle here, if this bone is a lot longer, that could just make more pressure to the ball of the foot. Here's an example of an effusion, which would just be swelling that can be seen in an ultrasound. So a lot of times these patients, they need x-rays and then an ultrasound or an MRI or something else like that. Here is the checklist that I use. I want to start with this because this is the easiest way. Then I'll kind of go into a little bit more detail. I always start with an x-ray. We might do an ultrasound. If we're unsure, we'll get an MRI. And then in terms of repairing and healing, for a lot of these that are more bone-related issues, we'll do shockwave therapy. I don't use too much amni or PRP on these things. Cortisone injection, I don't do too much into the joint. I would do it between if it was a neuroma, but not much into the joints. You can do anti-inflammatory icing. These are things that people do before they come in and see us. Physical therapy can be used sometimes to loosen the calf muscle if it's very tight, foam rolling, stretching. And then there's a lot of different types of pads, and I'll go in some of those that you can be used to kind of strap the toe down, especially if you have a hammer toe that's stuck up. And then a supportive shoe. I always start. So if you want to start with something, you start with shoes. You want to start with a very supportive cushioned shoe. The most common one, if you don't have like a bunion or a hammer toe, would be like a Hoka. Then a lot of times, if you need a wider foot shoe, you might do like an Ultra or a Topo. Those are the most common ones I'm recommending now. And then you might need an orthotic as well to offload that area. A walking boot can be used if you're just having pain all the time or you find a stress fracture. So let's go into some of these treatment options. To reduce the stress and strain on the front of the foot, we use orthotics to help with posture and alignment, and there are different modifications where you can take the pressure right where it hurts. Now, the key to an orthotic is to have it contour very nicely to your arch. And that's really the key. That's the main difference between this and something that you can get over the counter that doesn't contour as much. The more you contour, the more it takes the pressure off the ball of the foot. There are other types of modifications you can use as well with your orthotic. I do a lot of shockwave for pain to the front of the foot. This is a treatment modality where it uses a bullet that goes back and forth, hits this piece of metal, causes these radial shock waves. This is an example on the heel. I usually do it to the ball of the foot. And I do this for painful metatarsals that aren't a stress fracture. And what it does is it helps with healing. And this works very well. Basically what it does is it injures the tissue, because a lot of times these become chronic areas of inflammation. And if you remember from the pictures before, they're colored white. And I think it's so important. I'm actually going to go back and I want to show you some of this in terms of the anatomy. If you look at the anatomy here, this is all white and this is all white. And you see this red right here? That's muscle. So muscle has good blood supply. All this white stuff doesn't have the best blood supply. And most of the treatment for these areas that are white tend to be challenging, such as plantar fasciitis, Achilles tendinitis, things like that, because there's not the best blood supply. So what this treatment does is it actually injures the area to increase new blood flow to that area. So this is a very beneficial treatment for this. We do use some injections in certain areas around tendons, around nerves. This is the amniotic injections that we do in the office. Those can be used if you have an area of inflammation and you don't want to do a cortisone injection. Certainly the standard, a lot of patients, they use anti-inflammatories. I don't like to use it more than 2 weeks. If it doesn't help, you probably need something. And it's not just a new shoe. If you've tried 10 shoes, it's not just another shoe that'll cause a solution. A lot of my patients as well, they do well with icing and contrast baths. A real key is to do contrast baths. So it's 5 minutes in ice, 5 minutes in hot water, then back in 5 minutes in ice water. That can be helpful. Once again, if you've done that for a couple of weeks, it's not getting better, you should probably see someone, but icing is important. Reducing the calf, the tighter your calf is, the greater forefoot pressure you have. So loosening the calf can be important. A lot of patients that do a lot of walking, they get pain to the front of the foot, and loosening the calves can really help reduce that load. There's a modality called Graston Technique that the physical therapists do. We send people out for that. Even though the bottom of the foot hurts, I know, but we still work the back of the calf and everything else. Here are some home tools that you could use, different trigger point balls, foam rollers, things like that. And then there are a lot of pads. For example, if you have a hammer toe that sticks up that's causing this ball of foot pain, you can use one of these pads called a Boudin splint. There are different types of pads called crest pads that go under. There's these metatarsal pads that go in the shoe. There's ones that stick on your feet. There's tons of different things that you can get. Once again, if you spent more than $100, go see a doctor. It's probably just going to be a lot easier to get treatment. And then for a lot of my patients, if they have a stress fracture or something, I'll put them into a walking boot or something like that. Okay. So those are kind of some of the treatment options. I like shoes. Different types of shoes can be helpful. The easiest thing to change, guys, is changing your shoes. Okay. Hoka's, Topos, Asics, New Balance, something like that. Don't go cheap on the shoes, please. Don't go cheap on the shoes. You want to get something that's good. Once again, if you guys have any, you can have your own question. You can ask it. There's a place in the bottom of this, my blog, drpelto.com, to ask a question. And then once again, there are some advanced treatments that you could try. Shockwave, amnio, PRP. There's a lot of different treatments for this. And once again, the checklist. I like these checklists. So you can ask your question there. I'm going to hide this, but this is the checklist. This is the key. So if you're not getting better, look at this checklist and see, what have you tried? What's not working? And once again, forefoot pain, you need to see someone if it's not going away after a certain period of time. Okay, because occasionally you'll need other things that really can't be seen. So I hope this was helpful for you guys, and look forward to answering some of your questions. Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.